Welcome back. We got warmer temperatures in Santa Ana's this week. Time to pull those shorts back out of the closet, and here to help you have the legs you want to show off and to keep you healthy too with all of your vascular needs. We've got Dr. Anatoly Bolkin from San Diego Vascular Center. Wonderful to have you here today. Now, of course, getting rid of varicose veins or spider veins, that's just a small part of what you do. So let's talk about vascular health first, what that is and what sort of options you offer.
At San Diego Vascular Center, we do a spectrum. We see a spectrum of patients with vascular disease, and we try to concentrate on vascular health, exercise, diet, and also take care of the problems or vascular disease.
What are some of the vascular diseases and problems that people have?
So just to say a few words about vascular health, for example, everybody knows they have to have a good diet, and that means low fat, low cholesterol. But one of the issues which is most important is low salt. Many people may not be aware of it. Drinking a lot of water, and if you drink coffee, that means you have to drink 2 glasses of water to make up for it. Exercise, the best exercise you can do is walking. And we usually say about an hour a day, but if you have problems, you have to make up for it. For example, myself, I used to run a lot, and now I can't because of my knees, so I have to bike and swim. The diseases, on the other hand, are also a spectrum. You have people who have the beginning spectrum of the disease, and that applies to heart disease, stroke, leg disease, or varicose veins. And depending on what stage of the disease process you are at, treatment varies.
You see people of all different backgrounds, all different ages, and sometimes people could go in for something aesthetic, like here, and then you discover there's a deeper underlying problem.
Yes, and that's what we usually try to do. There is definitely a genetic component to ourselves, but also an environmental component. And if you look at the picture, the treatment may be simple, but before we treat patients, we usually like to do a screening examination to find out the cause. The outcome of treatments are also always going to be much better if you can find an underlying cause of the disease process. And the treatment varies. It can be something as simple as an injection, it can be something complicated as surgery, but the bottom line is if you can identify a problem and fix it, most results are going to be amazing.
You're basically a one-stop shop because you can fix things aesthetically, but what your motivation is that you want to get underneath to what the problem is so you can address that.
That's absolutely right. And you'd be surprised, most people who come to see us at very late stage of the disease process. Most of us don't like to admit that we have a problem until it's really bad. And I'm hoping that people seeing this program can realize that if you treat something earlier, you'll have a much better result at the end.
Well, I don't think it's a secret to say that a lot of wives or girlfriends, you know, kind of nudge their husbands or boyfriends to get in and make an appointment. So I would imagine a lot of men come in where they're in a lot of pain.
Men are the worst. When men come in, you know, it's a big problem.
You're like, okay, we got a big baby in room 3.
But we try to do our best, and we try to encourage everybody to keep up with it, because for all of us, whether it's your weight, whether it's the way you look, it's a dedication to that activity. And we all know what we have to do, but we try to we take our time, and then we forget, or we delay, or we neglect ourselves until it's too late sometimes.
I want to talk about a really neat option that you have given our viewers. If they like you on Facebook, all they do is go to sdvascularcenter.com, find the like button, you click it, you push it, they're going to be entered to win a $450 treatment.
That's correct. I just wanted to take a few minutes of my fame time to show this, and hopefully get some more people to know us.
I have to say, my dad, he doesn't live here locally, or he would go to your center. He had gotten some clogged arteries. He had been told to lose weight. He now he walks with a men's group every morning. They're a group of retired guys, and they get up, they walk, they gossip, they have fun. If somebody can't walk an hour a day, what would you suggest?
So that's a key thing. You have to try to find other people who can help you, to motivate you, and to be able to do the activity that you're able to do, whether it's pool aerobics or whether it's some activity that you like or you enjoy, and that will change with age and time. And I think that's a wonderful thing to do, to find a group.
Well, it motivates him because they ring his doorbell and he can't run away and say he's not home. So he's
and that's what I do too. I mean, I wouldn't cycle as much as I do now if somebody didn't ring my door at 6 o'clock in the morning and say, well, you got to go.
That's right. Thank you so much for coming on
my
today.
pleasure.
And again, all folks have to do is like your Facebook page and
That's
then
correct.
are entered to win the $460 treatment.
Thank you very much.
Thank you for coming in today. All right, more information. You can always check out our website, san diego6.com, and click on San Diego Living.